Hi guys, I hope you're doing well and I welcome you to the part 2 of our family planning discussion. We are going to pick from where we left and discuss the remaining family planning methods. We are going to begin with the implants. So implants are basically small plastic rods that are implanted under the skin of a woman, normally at this point of the hand, of the arm. And so these implants work by preventing or delaying ovulation, just as for the pills, and they also thicken the cervical mucus. These implants contain progestin, and it's slowly released into the woman's body from the arm. Every single day there is a small amount of the progestin that really is released into the body to prevent pregnancy. All right, so there are various kinds of implants, and so I'll discuss the ones that we have in our Kenyan setup. And so the first one is the Jadel. The Jadel has two rods. Normally they are small, very small rods, about say 2-3 centimeters, and they are thin. So the Jadel has two rods and it prevents pregnancy for a period of 5 years. We then have the implanon itself, and the implanon has one rod and it stays for 3 years. We then have a new one that is known as Levoplant, and Levoplant has two rods and it prevents pregnancy for 4 years. So it depends on the one you want, and it does not mean that if you have a Jadel that lasts for 5 years, you need to wait for the 5 years for you to remove and conceive. At any point you feel like you want to conceive, you just need to go and have it removed and you can conceive. Okay, so it's not a rigid method like now you need to, if you're having the implanon for 3 years, you need to have it there for 3 years. In some cases it may not go well with your body, and it may also need to be removed. So it's something that can be inserted and removed at any particular point. Okay, so and the way of insertion, it's a very easy and very fast procedure. So most of the time we have the one that comes with its own inserting instrument, and it's just this part is just cleaned up, and then the inserting instrument looks like a needle where the implants are loaded, it's inserted, and the implants are left under the skin. So it's a very fast procedure, and then on removal a small incision is made and the implants are removed. All right, they have their various side effects, just as the other family planning methods that we discussed last time. Maybe it might cause changes in your menstrual bleeding, it might cause headaches, nausea, breast tenderness, blood pressures, weight gain, name them all. But mostly they resolve on their own. Immediately after insertion, before the body is used to them, that is when you may experience these side effects, and they may resolve. And again, if the side effects are beyond what you can bear with, always see your health provider and have yourself advised accordingly. Maybe you will need to change them if the side effects can't be tolerated by your body. Otherwise, they are effective, and again, it's not like the pill that you need to be taking every day, and it's people consider it comfortable and very easy to use. I mean, you just get an implant and for 5 years you've forgotten about family planning. Okay, we then have the intrauterine contraceptive devices, the IUCD, commonly referred to as the Coil. It can be hormonal or non-hormonal, but in our Kenyan setup we commonly have the non-hormonal one that is known as Copper T. So Copper T is a coil that is inserted in the woman's uterus, and it acts by producing a chemical that changes the nature of the sperm to prevent it from fertilizing the ovum. It also acts by causing the body to have that a false being implanted in the uterus, and that will prevent an implantation of a fetus. So because it's in the uterus, the body already assumes there is something already growing in the uterus. And so in case there is fertilization, the implantation will not take place and the woman will not get pregnant, because already the body assumed there is something already existing in the uterus. So that is how it prevents pregnancy. Copper T lasts for 12 years, but again, it does not mean that you need to have the copper T for the 12 years. So immediately you feel like you need to conceive, or you have had an issue with the copper T and you need it removed, it can be removed at any time. Okay? So it is not a rigid method, and it's also a very safe method. I have said it is non-hormonal, that is the copper T, and so unlike the various side effects that are caused by the hormonal methods, the copper T does not cause all those other side effects. It has its side effects that maybe you could have heavy bleeding, heavy cramping at the beginning, at that point where the copper T was inserted before your body got used to it. But with time they resolve, and it's like I have said, it's a long-lasting method, and since it is non-hormonal, it can be tolerated by majority of women. All right, so I have done a demo of how the copper T is inserted, and it's a very fast procedure and easy procedure, as you will see in this video. And I would like you to appreciate, so that you don't feel like it's a painful procedure or it's tedious. So let's watch this video together. This is the IUCD. It's non-hormonal. I'm going to show you how we insert it from the point of insertion. There are a few other things that we do before inserting, and we also have a few other equipments that we use, but I'm only going to show you the way of insertion, so that you stop assuming it's a painful process. It's painless, it's just uncomfortable. So I'm going to use this dummy of the reproductive system, the female one, and here we have the vagina all the way into the cervix, and then we have the uterus in here. I'll show you how we do the insertion. This is the coil. We first fold the wings like that, and then we push this through the vagina, through the cervix, into the uterus until we get to the top part of the uterus known as the fundus. We then use this to push in the IUCD and leave it inside the uterus as we come out with the tubes. We are then able to clip the strings, and it's that fast and easy, guys. I hope that changes your notion on copper T insertion. You have noticed it's a very fast procedure, and I can assure you it is not painful. It's just a bit uncomfortable, and it could only be a little bit painful when we have some instrument that is used to assist in opening up the cervix so that the copper T can be inserted. The only maintenance that needs to be done is the woman checking the pad, that is the sanitary towel, every time they are having their menses before disposing it. You need to check that sanitary towel to ensure that that coil did not go out together with the menstruation blood. Sometimes it happens, and so that is why you need to keep checking. And from the facility where it was inserted, or if you're away from that facility, you will be given timelines on when to go for checkup. It needs to be checked if it's still in situ. Okay? And the other thing with copper T is that it cannot be inserted if a woman is pregnant. In pregnancy, no one interferes with the cervical opening, and because it's being implanted in the uterus, it cannot be inserted during pregnancy. And that is why you will commonly be told that you need to go for insertion during your menstruation, because at that time we are sure that you are not pregnant. It's also easier to insert during menstruation, because during the menstruation period, the cervix is not as tough as it usually is. It has opened a little bit to allow the menstruation blood to go out, and so it will become less painful and it will become more easy for the copper T to be inserted. Otherwise, it can be inserted at any time of the menstruation period as long as you are not pregnant. All right. Now, finally, we have the sterilization methods of family planning, and that is vasectomy for men and bilateral tubal ligation for women. Okay. Now, sterilization method can only be used if the couple is sure that they are done with their family goals. They are sure that they already have the number of children they wanted to have, they can go for sterilization, because it is not reversible. Unlike the other methods of family planning, whereby if you stop using that certain method of planning your family, you can conceive, for sterilization, it is not reversible. You're sterilized and that is done. So with the BTL, we have the blocking or the cutting of the fallopian tubes for the woman, and in that case, the ovum that is released by the ovaries is not able to get to the uterus, and so fertilization cannot take place and the woman cannot get pregnant. It is a very easy procedure as well. You do not need hospitalization, because just a small incision is made on the abdomen and an instrument is passed in and the tubes are ligated. All right. Now, after the ligation, the woman needs to use backup methods when having sexual intercourse to prevent pregnancy, because they need to allow for the tubes to completely heal for them not to conceive. We now have the vasectomy, and this is for men. The uptake is quite low. Men, you can share with us and tell us your feeling about vasectomy, but it's also a very easy procedure, because we just have the cutting or the blocking of the tubes that supply the sperms from the testicles all the way to the penis. Now, a common myth with this, and the reason why most men do not want to go for vasectomy, is the false myth that it will reduce the sex drive and such things. But let me make it clear that it does not reduce the sex drive. Ejaculation will still take place. And this is the reason. Vasectomy is only cutting off the tube that supplies the sperm from the testicles to the penis, and the sperms are the ones that now fertilize the ovum. Okay, we have another gland that is known as the prostate gland that produces the semen in which the sperms are. So semen is the production of semen continues, and that is now why we have ejaculation. Ejaculation will take place, the semen will be released, but it does not contain sperms. Okay? And so the sex drive does not change, ejaculation is still on. The only difference here is that we have ejaculation that contains only semen fluid but does not contain the sperms. In the same case in women, BTL does not reduce the sex drive. It's just the ovum that cannot be transported to the uterus. I hope that is clear. And so these are methods that can be appreciated by people who feel they already have met their family goals and they do not need to conceive again. And for the men as well, after vasectomy, they need to use a backup method during sexual intercourse to prevent pregnancy. That is because we also need to allow time for healing of the cut-off tubes. So we have discussed all those family planning methods. I know there are other various types of family planning methods. We have the diaphragms, we have the spermicides, we have cervical caps, name them all. But I just decided to discuss what is very common in our health facilities and what is easily accessible and can be used by anybody. And as we wrap up this, I'll still repeat, family planning is not a woman's only affair, so men kindly take up the challenge and get involved in family planning. And the second thing was that the side effects of the family planning methods are different on different people, and so you take up what is acceptable by your body. So do not be discouraged against a certain method because it didn't work for somebody. It can work for you. We have come to the end of our family planning discussion. I hope you have enjoyed it just as I have, and that it has been educative to you. You can consider sharing it with your friends, and let us continue educating one another on matters health, because as I have always told you, we are in control of our health. If you have any questions or any comments, please leave them at the comment section, and that will be appreciated. So until next time, take charge of your health, keep safe, and goodbye.